If you have a Part D prescription drug plan, the Medicare annual enrollment period is a very important time of the year. And if you let it pass by without doing this one thing, it could cost you. Hi, Joanne Quinn, co-founder of Medigap.com and independent insurance agent. I've helped thousands of people navigate Medicare since 2013. Thanks for being here today. So why is the Medicare annual enrollment period so important, and what is the one mistake that could cost you? Well, the annual enrollment period is the one opportunity that you have to change your Part D prescription drug coverage for the upcoming year. But the one thing that can cost you dearly is not reviewing your annual notice of change. The annual notice of change provides essential updates about your current drug plan, detailing changes for the upcoming year, including if your plan will be available. And even if you don't take any prescription medications, you still want to pay attention to this video. Now, the annual notice of change comes from your current drug plan company, and it may arrive in September, but you should definitely have it by the beginning of October. And if you haven't received it by then, contact your plan immediately. And while I know you get a lot of mail this time of year, and much of it is junk, please take the time to look for this document. It's rather large, usually over 10 pages of information. Please don't toss it aside because you are content with your current drug plan and you feel like just letting everything ride into next year. What I've seen through the years is that Part D drug plans change their plan benefits and cost each year. This year is no exception. In fact, because of the Inflation Reduction Act and the $2,000 out-of-pocket cap on prescription medications, there are concerns that plans will try to find other ways to compensate for their cost, and the most noticeable will be higher premiums, which means the plan that you have right now may not be the best one for you next year, and in some cases the plan may not be available at all. And while 10 plus pages of information may seem like a lot to review, keep in mind that you are looking for some important updates such as the monthly premium, annual deductible, co-pays and co-insurance, pharmacy networks, covered medications, prior authorization, step therapy, and plan availability. I know it seems overwhelming to sort through, but it is worth a few minutes of your time to make sure you are up to date with any changes to your drug plan that will impact you financially. Do you need clarity on Medicare topics? Click the link in the pinned comment to enroll in our free Medicare e-course. Now, what if you're happy with your current plan and you don't want to move to a new plan next year? Even if you love your drug plan or you're not taking any medications and have a very low premium, please don't assume that everything will stay the same next year. I know I sound like a broken record, but if you don't pay attention to the information in your annual notice of change, you could have a nasty surprise when you use your drug plan in the new year. Unfortunately, during the first few months of the year, I will always hear from someone that didn't know their premium was increasing, or their pharmacy is out of network, or their medication cost increased, or even worse, their plan was discontinued. Imagine showing up in March to pick up your prescription medications and the pharmacist charges you full price because your Part D drug plan was discontinued. Unfortunately, it has happened. Or you go to the pharmacy to pick up a medication you've been taking for several years and it was covered by your Part D plan last year, only to find out that you have to pay full price because that drug is no longer covered by your plan. Unfortunately, that has also happened. Or you find out that the medication that you paid a small copay for last year costs more this year because now you have to pay 25% co-insurance instead of a flat $5 copay. This too has also happened. All of this can be easily avoided by simply reading your annual notice of change and taking action to make sure you have the Part D drug plan that's going to work well for you next year. Okay, so how do you do that? Well, one, you can contact your insurance advisor to review your Part D options, or you can use Medicare.gov's Plan Finder tool, which will give you access to all the Part D plans available in your area. And if you have a Medicare.gov account, your prescription medication should already be listed in your account. You'll just want to take a peek and make sure everything is accurate. And although you may be able to view plans starting October 1st, the actual enrollment window starts October 15th and ends December 7th. And after December 7th, you can't make any changes to your Part D plan until the next Medicare annual enrollment period. I also want to point out that if you have a Medigap, also known as Medicare supplement plan, you won't receive an annual notice of change for your Plan N, Plan G, Plan F, etc. You may receive a letter about changes to the Part B deductible and other health care costs, but it's a courtesy letter to let you know that your Medigap plan automatically increases the benefits to accommodate the Medicare approved amounts covered by your policy. It's also important to note that Medicare's annual enrollment period is not available to change your Medigap plan. I know that's confusing because of all of the advertisements, but the plans primarily marketed for open enrollment are Medicare Advantage plans and Part D plans, since they qualify as official Medicare health plans that can be changed between October 15th and December 7th. Now, although the Medicare annual enrollment period is not available to change your Medigap plan, Medigap plans can be changed any time of the year with medical underwriting approval, unless your state has specific open enrollment opportunity throughout the year. Most insurance companies should inform you of your state's open enrollment opportunity if it's available to you. So let's review the actions you need to take. 1. Look for your annual notice of change from your Part D drug plan company. It should arrive in September or early October. If you don't get this important document, contact your plan. Number 2, read through your annual notice of change for updates to your plan's costs, networks, and medications to help you decide whether the plan will continue to meet your needs next year. And number 3, starting October 1st, review your Part D drug plan options by contacting your insurance agent or by using Medicare.gov's Plan Finder tool. And number 4, if you find a better drug plan, enroll in it by December 7th. Do you need clarity on Medicare topics? Click the link in the pinned comment to enroll in our free Medicare e-course. Get straightforward lessons delivered to your inbox and make informed decisions about your health. I hope this video was helpful, and I'll see you next time.